Good afternoon, everybody. My name is Darrell Steinberg. I have the privilege of representing the 6th Senate District in Sacramento, and I'm President Pro Tem of the California State Senate. I'm joined here by a champion for social justice, Assemblymember Tom Ammiano, and by the representative of another champion, my colleague in the State Senate, Mark Leno's key staff person, Anna Damiani. We are here today at the Mission Neighborhood Health Center together with people who dedicate their lives to helping those living with HIV and AIDS, to helping those families who want nothing more, mostly working families who want nothing more than to ensure that their children have preventative health care, to those who care for the sick and the elderly, to say that we are going to fight to restore the illegal blue pencil cuts that the governor made when he signed the budget 2 weeks ago. We take this step, and I filed a lawsuit on Monday in the San Francisco Superior Court. We took this step for a couple of important reasons. First of all, the legislature spoke, and the legislature made some very difficult decisions, including massive cuts. The governor exceeded his legal authority by cutting further, and we intend to make that point in court. But there's something even more significant to the people who work here and to the people who get their care here. Because of the economy, because of the historic $62 billion deficit that we have dealt with over the past 9 months here in California, we have had to make some very difficult decisions, including making cuts to California's safety net. But at some point, and that point is right now, enough is enough. Enough is enough. The people who need help have given enough when it comes to the state budget. And you all know and read about the particular problems we have in Sacramento. The most prominent when it comes to why we are standing here today is the irrational 2/3 supermajority requirement to pass a budget or to raise revenue. And up in Sacramento, you know, you kind of get caught up in the conventional wisdom a little bit. Oh, you can't raise taxes. Oh, we can't raise taxes. Oh, we just have to get this done. And certainly, Assemblymember Ammiano and I and our colleagues, Senator Leno, worked very hard to avoid an economic catastrophe, and we did so by making the difficult decisions. But in what other civil society, in what other state, in what other country could anyone make the reasonable argument that it is a better choice to cut tens of thousands of children off of health care than it would be to raise a tobacco tax? In what other civil society would it be accepted that we would put in jeopardy and danger thousands of HIV and AIDS patients who can live good and normal lives with the right kind of treatment instead of raising a tax on oil companies? We filed this suit because we see a different California. A California that is fiscally responsible, a California that balances its books, but a California that says the first priority of a decent society is to care for those less fortunate and to educate the next generation. We have played defense for 8 months out of necessity, because to not have acted would have meant potential collapse of our economy and worse harm and pain for the people of California. But we're tired of playing defense. We're choking on it. It's time to take the offense. It's time to assert our view and our vision of what a fair and reasonable budget ought to look like. And the lawsuit that I know you all support and that brings us here today is an important part of that new beginning. Let me turn it over to Assemblymember Amiano for a few comments. Tom.
Thank you very much. I really appreciate the leadership of the Pro Tem. I want to say to him, bienvenidos to the neighborhood. It's wonderful to see him here. And nice suit, no pun intended. Speaker Bass as well, and I had a conversation earlier this morning, and she's 1,000% behind Darrell on this issue. We've all been put in an untenable position. People expect us to cannibalize each other and say, well, we want ours and you can't have yours. But when it comes to AIDS care and prevention, when it comes to black infant care, when it comes to domestic violence, there are no choices. They are our choices. We just don't want a piece of the pie. We want a whole new pie. And if the governor insists on dipping his pencil in blue bile to settle some kind of petty political score on the backs of children, on the backs of people with AIDS, on the backs of people who suffer from domestic violence, on the backs of high infant mortality in the African American community, then we say not only is that illegal, that is immoral. We do want to turn over the two-thirds rule. Instead of helping in the discourse, it has held us all hostage. It needs to go. We need to look at more exciting things to include increase revenue. You know, the oil severance tax would have raised $900 million. But because the governor got a bug up his butt and because the Republicans are in lockstep with some cult, $900 million is not going towards this clinic. $900 million is not going towards AIDS prevention and research. It is a crying shame. It is criminal. We should release criminals early and put the governor and his ilk back in to replace and put them on bread and water and see how they like it. As you know, I've introduced some legislation to look at the legalization of marijuana and the $2 billion that could garner for our state budget. We also want to look at the split roll. Did you know that you wanted to look at the split roll? We want, in terms of Prop 13. We really need to break the chains that have bound us in the past number of years, particularly with Mr. Schwarzenegger as governor. So yesterday, Harvey Milk got a really wonderful award from President Obama. And as you know, Milk's message was one of hope, and that's what we're presenting to you today. We're going to be in there fighting for the rest of the time that we are in office, and we hope to have new leadership in terms of the governor's office as well. So thank you very, very much for all attending.
Good afternoon. My name is Anna Damiani, and I'm here on behalf of State Senator Mark Leno. He regrets that he couldn't be here with you today, but he did ask me to read a statement on his behalf. My colleagues in the LGBT Legislative Caucus and I are outraged by the governor's line-item vetoes that slash state funds for critical programs, including HIV and AIDS-related services, health care for children, and services for survivors of domestic violence. Having led the charge to spare these programs and services from deep cuts as a member of the Budget Conference Committee, I believe it is an extreme act of bad faith for the governor to unilaterally cut these programs after the fact in a disproportionate, cruel, and inhumane way. Governor Schwarzenegger's cuts are a shameful assault on children and elderly, disabled and chronically ill Californians, when instead the governor could have recommended the closure of tax loopholes for corporations and the wealthy. His continued attacks on social programs that support the neediest Californians is not a value my fellow Democrats and I share, and it's not a value shared by everyday people in our great state. I am pleased to support Senator Steinberg's lawsuit because it is clear the governor has overstepped his constitutional authority. Thank you very much.
Thank you very much, Anna. Thank you very much, Assemblymember Amiano. I next want to bring up some people who can tell the real story about the impact of the governor's decisions 2 weeks ago. You know, we deal with spreadsheets in the Capitol. Every number is about a child. Every number is about a family. Every number is about an elderly person who needs help. And so every $500 million matters when it comes to preserving the safety net in California and helping tens of thousands of people. So I'd like the following folks to come up, if you would. You can come up together and go one right after another. Ricardo Alvarez, who is the medical director of this Mission Neighborhood Health Center. Dana Van Gorder, who's the executive director of Project Inform, which represents HIV-positive people in the development of treatments and a cure. Beverly Upton, the executive director of the San Francisco Domestic Violence Consortium and Partners Ending Domestic Abuse. Domestic violence took an unfair, domestic violence shelters took an unfair, disproportionate, and devastating hit as a result of these actions. Wilma Chan, the Vice President of Policy for Children Now and former colleague of mine in the State Assembly. And Dina Land, the Policy Director for the Children's Defense Fund in California. And we also have available someone who I refer to now as my lawyer, Robin Johannesson, the partner at Remcho, Johansson, and Purcell, who is the lead attorney for the lawsuit we filed Monday in San Francisco Superior Court. Please.
Mission Neighborhood Health Center has taken as its mission to serve people regardless of their insurance status. We serve, our mission is to serve the Latino community regardless of their documentation status. I'm extremely proud of the hard work of my colleagues to fulfill that mission, and I wish to just share a message to translate those numbers into real lives. We're talking about the potential impact of losing the EAPC program, which translates to over 1,500 uninsured patients no longer receiving insurance. That's 4,500 medical visits. We're looking at the prospect of completely eliminating funding for HIV treatment and care. Those are the services for people who are most in need. And most importantly, we're also looking at the impact on healthy families. So we're already struggling with how to handle the referral of a sickle cell patient, the referral of a child who needs a surgical consultation, all of which are held in this limbo status regarding insurance. And I want to appeal to those who are decision makers to marry the compassion and the rational. There's a tremendous amount of data in the health literature regarding the cost, the long-term cost of denying these services, these preventive services. We're appealing for the marriage of the heart and the mind, and we're hearing words of those who are in power who are making some very strong decisions about how to get the message out that this is not acceptable, that we cannot sacrifice our next generation, and we can't sacrifice the most vulnerable. I want to now turn the mic over to Dana, who's going to speak a little bit more regarding the HIV sector. Thank you.
Thank you very much. I want to thank President Pro Tem Steinberg for the action that he's taken today. It gives me no particular joy to stand here to support this lawsuit against Governor Schwarzenegger. Up until this month, he has amassed an admirable record on HIV and AIDS and has supported the growth of vital programs to respond to the epidemic. I want to make it perfectly clear that HIV advocates are entirely aware of the fact that the state is in fiscal crisis, and we made every effort to talk to the governor's staff about making responsible reductions to HIV programs. We do not believe that HIV should be held harmless from cuts, as programs that meet the health care needs of children, the elderly, and other vulnerable people are devastated. But the governor went much too far with the $85 million in cuts he arbitrarily made to HIV services. These cuts mean that fewer Californians will know their HIV status at a time when the federal government is working desperately to try to make sure that more people know their status. The cuts will mean that people are unable to take the steps that will protect their lives and their partners from becoming infected. The cuts mean that people disabled by HIV or AIDS will lose the housing that is essential to staying healthy. They mean that more Californians will become infected with HIV. They leave access to life-saving medications for low-income people vulnerable, and they mean that the state will have to spend much more in future years to clean up this disaster than it saved in this year's budget. As advocates, we are also extremely angered that if the governor hated to make these cuts, his administration has made no effort whatsoever to assemble HIV advocates and service providers to determine how to mount an effective response to the epidemic in the wake of this devastation. We are on our own to do that work. We agree with President Pro Tem Steinberg that the governor did not have the authority to make these blue pencil cuts that threaten so many lives, and we thank him for bringing this suit. But I do not believe the governor is entirely responsible for these and other devastating cuts to health and human services. We hope that the state assembly leadership will take the action to bring its members back into a session to approve $1 billion in revenue from the highway users tax that could have helped us to prevent these cuts. Thank you again, Mr. Steinberg, for this opportunity to protect the social services safety net in California. We applaud you for this principled effort.
Hi, good afternoon. My name is Beverly Upton. I'm the Executive Director of the San Francisco Domestic Violence Consortium. Victims of domestic violence and their children were cut 100% from the governor's budget. We too felt like we had an agreement with the governor's office and the legislature to take a 20% cut. We were willing to share the pain. Shelters have been figuring out how they could reduce, what they could do with a 20% reduction. On the day the governor signed the budget, it turned out to be a 100% reduction. That's only $20 million in California because the shelter system really runs on a shoestring. So we are so hopeful that we want to thank everybody in leadership, and we are so hopeful that these dollars can be restored along with everyone else's dollars. What we're also hearing in the press is only a few shelters might close all the way. Well, that's true, but if one of our sisters or one of your brothers needed to be out of San Francisco because of a domestic violence situation, you would want one of our rural shelters to be open to be able to take that victim. And under the current scenario, they won't be able to. So when one shelter suffers, they all suffer. So we thank the senator for his leadership. Certainly we thank Tom Amiano for his leadership, as always, and Mark Leno. But we have to do this, we can do this, and we will do it. Thank you.
Good afternoon. I wanted to thank Senator Steinberg also for his leadership in this legal action as one step in reversing the brutal cuts to California's low-income children. And I also want to point out and thank California's First Five Commission, who this morning voted to give $81 million to the Kids Health Program. Yeah. It's really sad. Just 2 months ago, we stood in this exact spot. A lot of people here and children and doctors pleading about the insanity of denying poor children health coverage when the federal government actually pays most of the cost. And while 13 other states have taken advantage of new federal dollars to cover every single child in their state, we have seen our kids brutally savaged and our state lose millions of dollars in federal aid. The first proposed cut to children was $70 million in May. Then it escalated to $124 million in the budget that was recently adopted. And with the illegal action taken by the governor with his blue pencil veto, it has risen now to $174 million, which would mean that 700,000 children in California would lose their health insurance. But numbers don't tell the real story. The real story is that children in the clinic today who've been seeing their own regular doctor for many, many years, this program has existed for 12 years, all of a sudden will have no doctor. And the only treatment they can get will be in the emergency room. This is just immoral. These children do not qualify for other programs, so there really is no other choice for them. And how would you feel if it was your child or your grandchild? Again, in closing, I want to thank the senator for recognizing the perilous position that these children are in and taking one step to redress this terrible wrong. Children now fully supports the legal effort and promises to offer whatever assistance we can. And we have also developed and actively fought for very specific solutions, such as first $5 to make the program entirely whole. Our goal is to save every single child in California from the recent budget actions and to expand coverage to all children in California. Remember, it's easier to raise a healthy child than to fix a broken adult.
Thank you. Children's Defense Fund supports Senator Steinberg's actions about the illegal blue pencils that the governor took, but we believe that there is much more that needs to be done as well. We believe each and every citizen in California is responsible, each legislator, the governor, everyone is responsible for not standing up and saying, this is enough. As Dr. Alvarez mentioned, we have the science. We know that it saves money to give kids preventive health care. We know it saves money to give kids good schools, preschool education. We know all that, but we're not doing it. We're going the other way. There is considerable data about children exposed to domestic violence and what it does to them. We have a program, a CalWORKS program, that was designed to protect children so that even if their parents, for one reason or the other, did not meet the program requirements, there was a minimal grant for children. That's not going to be true anymore. It's not going to be true anymore that a child who appeared at Children's Hospital Oakland the other day with anemia, made a little bit too much money from Medicaid, went to their doctor and they were told, you don't have insurance, go to the ER, shows up in the ER with an earache, told that there's a very low iron count and needs to have further hemoglobin work to find out what the cause of it is. We don't know. Could be something very serious, could be a dietary reason. She'll never know because she doesn't have insurance anymore, and it'll be very difficult to follow up on an illness like that. So we are doing something that doesn't make any sense, and I believe that is everybody's responsibility to let their legislators and the governor know this is unacceptable. There are other things you could do. You can close corporate tax loopholes. You can do a cigarette tax. You can do a lot of things. And how did we end up in a position that children who currently have health care and currently have a roof over their heads are going to be impacted because of these cuts? Thank you.
Thank you, Dina, and thank you to all of the advocates. I also want to recognize Judith Arbach from the San Francisco AIDS Foundation, who's available to answer questions after the conference is over. Concluding comment. The lawsuit is one part of a larger strategy. It is not the whole solution. For healthy families, for example, it would restore $50 million out of the $190 million that has been lost. Wilma Chan just announced that the first fives put forward another $81 million. Well, whether it's in one fell swoop or whether it's bit by bit, as this economy recovers, as we continue to fix California, we're going to fight to restore not just the blue pencil cuts, but most, if not all, of the cuts that have been made on the backs of the least among us. But let this be, as I said, the beginning of a rallying cry and the beginning of a change for California. Glad to answer your questions. John?
Even the nearly half a billion that was blue pencil didn't make up for the, I think, about 1.1 billion that the Senate approved and didn't get through the Assembly. Right now, the numbers the controllers are putting out shows that times are going to be tough next year, and there's even the possibility that you're going to have to go in and make some more changes to the budget before June 30th. How do you deal with that?
Well, we know a couple things. Number one, there are ways to replace the $500 million or so of restorations that we seek. First and foremost, there was a five-party agreement to pass the temporary loan, and it was a temporary loan from local government from the Local Streets and Roads Funds, otherwise known as HUDA. You go back to that. That's one way. That's one way. Secondly, we know that because of, there's very little positive here, but because of the fact that we did successfully work through $62 billion worth of deficit reduction, that we stand a good chance of selling the so-called revenue anticipation note that will allow us to have the cash that we need until now and the end of the fiscal year, which is June 30th. And, you know, I look back on my first 9 months and say, how in the world did we, in fact, get through this? I mean, we have acted responsibly to avoid, as I said earlier, an economic catastrophe. If we can buy 6 months, if we can buy 9 months to fight to restore what has been lost, but also to change those parts of this broken system that we know are broken, whether it's the tax structure, whether it's the misalignment between state and local government, whether it's the initiative process, whether it's the 2/3 requirement replete throughout our system. We need to take advantage of every one of those moments. And you know what? We have, we've cut enough. We have cut enough. We have cut nearly $40 billion over the last year. And we started with just barely over a $100 billion budget. Enough is enough. I say to the governor, I say to the Republican leadership, if we do have to come back, and there is more deficit to reduce, give us your preference, your top 5 choices for how to raise revenue in a responsible way, and we'll be happy to take those proposals to our respective floors. We've cut enough.